is my numbness and tingling because of my diabetes? Should I be controlling my sugars more? We get this a lot, both on the YouTube channel and also in the office, about people coming in and they're very concerned that either they're diabetic or they're pre-diabetic and they're worried that their numbness and tingling must be coming because of the diabetes and that it's only going to get worse no matter what they do. A few things. First of all, diabetes absolutely can cause a peripheral neuropathy. Usually, if it's going to be someone with diabetes for a long time, often where the sugars have been uncontrolled. Definitely, if you have diabetes, you want to be controlling your sugars as well as possible. And the possibility of a neuropathy or the actuality of a neuropathy, if you have one from the diabetes, only makes it all the more important to be controlling your sugars as well as possible. Now, with that said, if you have numbness and tingling, there's a textbook worth of reasons that can be causing that numbness and tingling. Diabetes is the most common for certain kinds of neuropathies, but it's just one of many, many, many. So if you have numbness and tingling, first of all, on one side, and if you have leg pain and back pain, that's almost certainly not coming from diabetes. It's almost certainly coming more from like a pinched nerve in your back or an inflamed nerve root, sciatica, something like that. If you have numbness and tingling in both of your legs, then diabetes goes higher up on the list. It is the most common identifiable cause of the causes that we look for, but it's still the minority, right? It's a large minority of the causes. So it's something that needs to get worked up. You want to make sure there's not any number of other kinds of things causing the neuropathy. So, for example, Lyme disease, low folate, low B12, low thyroid. There's all sorts of reversible treatable causes that can look like a diabetic neuropathy, but it's really coming from something else, even in somebody with diabetes. And of course, more than one thing can be contributing to a neuropathy or to numbness and tingling in your legs. So, long story, a little bit shorter. If you have numbness and tingling, you want to get it worked up. It is something that can be found out if it's coming from your diabetes or from something else. So, you don't want to be just sitting on it. You want to start getting it looked at and probably start with a nerve test. If that nerve test shows a generalized neuropathy, it probably leads to some blood work and you follow that algorithm out. Diabetes is one important potential cause, but it's just one of many. So you want to make sure you're getting it worked up so that you can get to the bottom of it and start the process of hopefully getting it better.